this cross-sectional study, we investigated the link between caregiving hours and reporting of moderate to very severe menopause symptoms. Hello, I am Dr. Mariam Saadeddin, and I am a current OBGYN resident at the George Washington University Hospital and a former postdoctoral research fellow at the Women's Health Center at Mayo Clinic in Jacksonville, Florida. Today, I'm very excited to discuss with you an original article that will be published in Mayo Clinic Proceedings entitled Association of Informal Caregiving and Menopause Symptoms in Midlife Women, a cross-sectional study. The key takeaway from this paper is that a higher number of caregiving hours per week is associated with a greater burden of menopause symptoms. In this study, this relationship persisted even after adjusting for factors such as daily stress and overall mental health, highlighting the previously unexplored intersection of menopause and caregiving experiences in midlife women. A family caregiver is defined as a person who provides unpaid care, assistance, or support to another person with whom they have a personal relationship, such as a spouse, a parent, or a child. As the US population continues to age, we anticipate that the need for caregivers will continue to rise. Caregiving is already known to be associated with poor health outcomes, financial strain, and a higher likelihood of work reduction or retirement, particularly among disadvantaged groups. However, its impact on menopause symptoms had not been previously assessed. To conduct this research, we analyzed data from over 4,000 women aged 45 to 60, and we used validated questionnaires to assess caregiving responsibilities and menopause symptoms, adjusting for potential confounding factors. Our findings revealed that as caregiving hours increased, so did the likelihood of experiencing moderate or worse menopause symptoms. Women, particularly providing 15 or more hours of caregiving per week, had significantly higher odds of reporting these symptoms, even when adjusting for factors like relationship status, employment, hormone therapy use, daily stress levels, and mental health. The burden was evident also across all symptom domains, including somatic, psychological, and urogenital symptoms. Furthermore, caring for multiple types of recipients, such as a child and a spouse, or a spouse and a parent, did not significantly increase the odds of encountering moderate or severe menopause symptoms compared to caring for a single type of recipient, highlighting again that it's the allostatic load of caregiving, such as caregiving hours, that is negatively influencing the menopause experience. These findings are highly significant for our caregiver patients, helping them feel seen and validated by their healthcare providers. Here at the Mayo Clinic, the co-authors of this paper, including the senior author, Dr. Stephanie Fabian, are all menopause care practitioners who address menopause concerns for midlife women on a daily basis. Moving forward, we plan to incorporate questions about caregiving responsibilities into our patient encounters. Identifying caregiving as a potential risk factor for worse menopause symptoms enables us to provide a more holistic and personalized care. Caregiver status should be routinely assessed and documented in health records to identify potential caregiving-related risks, including those tied to menopause symptoms. Future research should aim to comprehensively address the caregiving burden, not only by examining the number of hours spent caregiving, but also by exploring the perceived burden of caregiving and the duration of caregiving. These factors may further contribute to a more challenging menopause experience and will hopefully help further support our findings. Thank you so much for listening, and I hope you check our publication in the next Mayo Clinic Proceedings issue.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel. www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.